As we continue today's NHS Scotland Alliance Live special, I'd like to welcome our next guest, Anne Armstrong, Scotland's Deputy Chief Nursing Officer. Welcome, Anne, and thank you for taking the time to join us. Please, can I start by asking how you're doing today?
I'm good, Tommy. I'm really enjoying thinking about being at this conference and getting out and about. So I'm delighted and great, feeling great to be here. Hopefully you are too.
No, absolutely, and really looking forward to our conversation today. And please, for myself and for people listening and visiting the conference, can you tell us a little bit more about your role in Scottish Government as a Deputy Chief Nursing Officer, and what does this mean?
Thanks, Tommy. Well, I started in this role in July, so I keep telling everybody I'm still new, and I'm claiming that at least I'm a year in post. I'm still new and still very much learning and listening to what people are saying about what's needed in services. I've worked in the NHS for many years, and I'm now getting a much more stronger connection with the care home sector, which I am delighted about. So very much a broad portfolio. Key things that I would be involved in is leading on excellence in care, providing advice to Scottish Government on a whole range of issues, thinking through about how do we develop the workforce to enable remobilisation to happen in the NHS, for example, integration, that joined up approach to care, and leading with some work on the care homes and community nursing. So in essence, it's about collaborating with people right across the country with a view to setting the conditions that enables great care to be delivered, regardless of where you are. So exciting times, and I would absolutely recommend the post for any aspiring Deputy Chief Nursing Officers coming forward in the future.
Oh, lovely, and it sounds like a really exciting and wide-ranging portfolio and piece of work. So thank you for that, and for sharing a bit more about the role. So we're here today at the NHS Scotland Conference here in Aberdeen. Can you tell us how your colleagues will be engaging here during the event?
I can. As you know, nurses are the largest group of clinicians right across the NHS, and they also work in social care. So there's not much happens without my frontline nursing colleagues right across the country. Many of them are here, and some are presenting, and many are engaging in the various sessions right across the next couple of days. And they'll be reflecting and thinking through what does that mean for them in practice, and how do they utilise the learning from the next couple of days to really improve care in their area and across the country.
Oh, lovely. And it's a great opportunity to reconnect, isn't it? And share practice, share stories, and get to reconnect again. So, Anne, the pandemic has been pretty challenging to health and social care over the last couple of years. What are the challenges and the opportunities that lie ahead for nursing colleagues in Scotland?
You're absolutely right, Tommy. It has been really challenging the last couple of years, right across, whether it's health or social care. Lots and lots of challenges. The couple I think that we really need to focus in on, of course, is remobilising. So catching up on all those interventions that's not been done for the last couple of years. And of course, many people have held back going to their GP and others. So quite often they're more complex when they do arrive at us. And of course, we have a very exhausted workforce. I've included my nursing colleagues in that. They're absolutely exhausted. So we need to think about how we support them to continue to provide the great care they have provided throughout COVID and before that, actually. Opportunities, I think there's many opportunities going forward. So as you know, technology and digital came through quite a lot during COVID. Near me, and different approaches to digital were fantastic. So I think we can build on that. There's opportunities just to link up more primary care, secondary care together around multidisciplinary teams. Of course, nurses will be absolutely up the middle of that and advancing their practice, whether that be in digital or whether it be in a range of clinical interventions and assessments. I think the other bit for me is about integration. How do we work even more closely together? And of course, the NCS in the next few years will start to develop that even further for us. And again, nurses have a huge role to play in that space. And the last thing I would say is around mental health and well-being. Yeah. I think one of the opportunities that the pandemic allowed us Was it for it to be okay to be not okay, for people to be able to say how they were feeling emotionally and mentally? It was quite often, as you know, people don't want to say how they feel, they put on a brave face. And I think the public, our clinicians, and I include nurses, midwives, CHPs, healthcare scientists and medical staff, are more able and more likely to feel that they can say about how they genuinely feel. And certainly we've developed much more in the way of self-help tools and specialist services to help them around mental health and well-being. And I think there's a real opportunity to build on that, and for it to be okay to continue to talk about how you feel, both physically, mentally and emotionally. We can't let that go. We need to build on it. So we absolutely look at each person holistically, their physical and mental health needs as we go forward.
Well, thank you. That's a really important message. You know, personally, as a son, I cared for my mum at home for nearly 6 years, and actually, you know, when I look back at it, I think I wish she'd have been more kind to me during that time. I think somebody asked me after that, what's the first message you would like to give to people? That, and it was, it's okay to ask for help. And I wish so. I'm really glad that that's a strong message that about caring, because I mean, my goodness, Anne, where would we be without you and all your colleagues? You know, where would we be without you? So I'm really glad that's a strong message in there. So thank you, Anne.
Absolutely. You've got to be okay to enable you to help others.
Yeah.
So it's really important that you take the time to look after yourself and be the best version of you to enable you to provide the best care.
Lovely. I'm really glad to hear that message today from leadership. So thank you for that, Anne. And can you tell me a little bit about how you will be spending your time at the conference?
Well, I am absolutely delighted, Tommy, to be getting out and about and seeing people. I love speaking to my colleagues and listening and learning from them. So I've got a number of sessions I'm going to be listening into. I am really keen to chat to my frontline colleagues in particular, whether that be the background from healthcare or social care, to understand what works, what doesn't work, because it then helps when I'm thinking about national policy or national work, so that I think that through when we're looking to put a range of policies or approaches or guidelines in place, to have that real life experience and examples, so that I do my best work. So that's what I'm going to be doing. And of course, I'll be helping to man the stall, the CNO stall as well. So looking forward to chatting to people and listening and learning.
Oh, thanks, Anne. And that was a big call out. If you're at the conference, please visit Stand 60 and have a conversation with Anne and colleagues at the conference. A great opportunity to go and ask some questions and share some stories. And as we come to the final question, what message would you like to give to colleagues who are listening to this interview and your nursing colleagues across Scotland?
I would like to say thank you first and foremost for the last 2 years, but actually before that, Tommy, because the work that they do is phenomenal. You can't underestimate that, and I'm absolutely in awe, particularly of my frontline colleagues. I think they have really been magical in their approach. So I would like to say thank you. I would like to say how important it is to take the time to look after you and be your best self, to enable you to provide the best care possible. And I look forward to catching up with you. Please come and see me in Stand 60.
Oh, thank you. What a lovely end to the conversation. And thank you for such a brilliant conversation today. Thank you for taking time to join us. Our next guest today will be Justine Craig, Scotland's Chief Midwifery Officer. But once again, Anne, thank you so much for your time today. And I look forward to seeing you over the couple of days. Thank you very much.
Thank you.